So we're very happy to start our first FHS seminar of this academic year. And I'm very happy to see a room full of students and faculty and staff. So I hope it will be the case for all of our seminars. So Narod Seroujian is an instructor of anthropology in the Department of Sociology, Anthropology and Media Studies at AUB. She was the 2020 Amsterdam Merit Scholarship recipient of the Graduate School of Social Sciences at the University of Amsterdam, where she received her MSc cum laude in medical anthropology and sociology. She has conducted ethnographic fieldwork in Beirut in the aftermath of the August 4, 2020 port explosion, exploring how wounds and scars become affective social and political entities. Narod has previously worked as a writer and researcher at various local and international organizations and has consulted for a WHO-funded scoping review project. She's currently researching how cancer patients navigate illness and livelihoods amidst Lebanon's political, economic, and social collapse. It's a pleasure to start today with this very special, I think, seminar. The floor is yours.
Hello, everyone. Thank you, Rina, for the introduction. And thank you, Rina and Mayada, for organizing the Health Talk series this semester and for inviting me. I also want to thank Judy for encouraging me to participate since last semester. I'm an instructor of anthropology in the SOAM department, and my background is in medical anthropology. And so the title of my talk today is Unstitching Wounds and Care in Wounded Lebanon. Now, I'm not trained medically to stitch or unstitch wounds, but I'll be unstitching wounds metaphorically from an anthropological perspective, particularly medical anthropology. I've been interested in wounds ever since I conducted ethnographic fieldwork for my master's thesis project about 4 years ago. And recently I found myself being interested in wounds again in the aftermath of the Israeli pager attacks that happened about a year ago on September 17, 2024. I will today discuss a few things. So I will start with an ethnographic moment true to my anthropological background. I will then give you some context and methods that I used to locate wounds, to study wounds from an anthropological perspective. My conceptual framework is grounded in material semiotics. I'll explain what material semiotics is and what it does and why, for me, it's an interesting approach. Perhaps we should. Okay, and I will theorize wounds from, and I'm inspired by two scholars, Omar Douachi and Jaspir Pouar. And then I will go into three analytical levels to think about wounds, to study wounds. I will look into how wounds are relational affective entities and social and communal entities, and then political entities. So I will start with an ethnographic moment, an ethnographic snippet. In April 2021, I sat in front of a Lebanese Armenian man in his 40s in a small rental apartment located in Beirut's Mar Mikhael district, about 4 kilometers away from the city's port, where 2,750 metric tons of unsafely stored ammonium nitrate exploded on August 4, 2020. Now, moments before the combustion of the chemicals, my informant, Hagop, it's a pseudonym, but I'm trying to do justice to his Lebanese Armenian identity. So Hagop, he was doing his daily jogging moments before the combustion of the chemicals. He was only about 500 meters away from the port. And the intense shock waves threw him off to the other side of the road, where pieces of glass and debris rained on him. And once he was able to reach one of the few functioning hospitals in the area, the other ones being partially or fully destroyed, he received up to 30 stitches on the middle part of his head and the left side of his upper forehead. Now, I was interviewing Hagop as part of my ethnographic research project on wounds and scars for my master's thesis. And I centered my interview around Hagop's recovery and experience surviving one of the largest non-nuclear explosions in history. And I was curious to grasp the kind of relationship he built with his wounds, how he perceived also the lingering scars. Now, Hagop's sister also sat with us in the room, and she casually intervened. She was making us some coffee, welcoming us into their home. And so she casually intervened to share her side of the story. After all, she was the one who took care of her brother, cleaned his wounds, administered his medication, and also inter-embodied his suffering. I'm using inter-embodiment, borrowing from Emma Bunkley's concept. And so this is what she told me. Of course, with those wounds, the other person, the person in front of him, will always feel like he's in pain and suffering and leaves a shock. Or, how can I say this? Like this feeling inside your body where you also feel the suffering. And she said in Armenian, which means in a sense, I also felt his suffering. I also felt his pain. I also absorbed his suffering and pain. Now, fast forward to about 3 years later, and I found myself yet again observing wounds, this time in a different context. I was absorbed by the digital circulation of photographs depicting the injured bodies of individuals that were victim to the Israeli pager attacks on September 17, 2024. Now, on that day, thousands of pagers, which we all kind of know, there are these wireless telecommunication devices that display alerts or short messages, exploded across Lebanon and some parts of Syria. And they were distributed to the Lebanese political militant group Hezbollah, containing batteries laced with PETN, explosive in small dosage, which makes it hard to detect. They were designed to detonate after loudly beeping and showcasing the message, press OK with both hands. And this was a way to encourage people to take the pagers in their hands and take them close to their faces, perhaps, to see the message, to read the message, to maximize the injuries. Soon after, investigative journalists revealed that the Israeli National Intelligence Agency, Mossad, had manufactured the pagers, forming a shell corporation in Hungary called BAC Consulting, which procured a license to manufacture from the Taiwanese corporation Gold Apollo. So whole chain, booby-trapped supply chain. So the detonation of these devices injured 3,000 and killed 12 individuals, according to the Lebanese Ministry of Health. And among the casualties were not only Hezbollah militants, but also women, children, medical workers, non-combatant civilians who are politically affiliated with the party, and media professionals. Now, what is the relation between these two events? And why am I trying to connect both cases? Now, the intensity of the detonations and the maximum devastation overwhelmed and overburdened the healthcare infrastructure in Lebanon, which is already fragile, already exists in a chronically debilitated and collapsing environment, Lebanon. And the images that followed depicted wounds that were unlike any other: severed fingers, charred faces, lacerated eyeballs, ruptured eardrums. Men, women, and children whose eyes were covered with bandages, and the bandage itself became as if a symbol, symbolizing incapacitated bodies, as well as a larger criminal power responsible for that incapacitation. Now, many recalled the port explosion of 2020 in terms of the huge chaos that followed the pager attacks and the large number of injured bodies. Now, we have two cases. Again, the Beirut port explosion, August 4, 2020. And in that case, I conducted ethnographic fieldwork and I interviewed injured individuals. And in the second case, which is a very recent project that I started, it looks into, I conduct digital ethnography, digital observations of photographs that are circulated on various social media outlets. Now, how to connect these cases? Though these are separate events, they are not isolated. These are not incidents but man-made. The wounds that follow these political events aren't accidental, but the result of decisions. On one hand, years of governmental mismanagement, neglect, failure, and corruption in the context of the port explosion. On the other hand, we have a foreign settler colonial entity that is exercising what Jasper Poor calls a right to maim, and exercising terrorist violence, debilitating bodies, deemed valueless, quotes rendered non-human, part of creating surface economies of control, unquote, again, quoting Jasper Poir. So I analyzed these both cases to look into how wounds carry multiplicity, simultaneously being relational, affective, and social, and then political entities, to examine how woundedness in Lebanon becomes a relational, inter-embodied condition. So I start now by giving you some conceptual, explaining my conceptual framework and some theory, and then we'll get to the data and the analysis. Now, I am inspired by material semiotics. I'll explain what material semiotics is. But so I've been inspired by this theoretical approach and school of thought, which is adopted by STS scholars, science and technology studies scholars, as well as medical anthropologists. And now, when I started being interested in wounds from an anthropological perspective, I started with these three simple questions. What is a wound? What does it become? And what does it do? So the beings, becoming and becomings and the doings of wounds. So yeah, what is a wound and what does it do? And can we even ask this question? Does the wound have any agency to do anything? And so here, my interest was, looking at these wounds, these agents that kind of lie between being human and non-human at the same time. They captured my attention. I was intrigued to look at them and attend to their agency and try to understand their power and what they unfold. And so material semiotics as an approach, as a theoretical approach, gave me the foundational concepts that I can work with to answer these questions. And so what is material semiotics? I focused, now it's a huge discipline, but I focused particularly on these two foundational figures which directly inspire me, Anne-Marie Moll and John Law, and they explain material semiotics in this way. So it's a set of tools and sensibilities. So it's not just a theory, it's a sensibility. It makes us sensible to certain things. For exploring how practices in the social world are woven out of threads to form weaves. So we're interested in networks and relations. They are simultaneously semiotic, they carry signals, they signify something, and at the same time material. So we're dealing with physical entities, the materiality of things. This is how Law explains it. Now, Moll also adds something interesting. So material semiotics combines two different fields. At the same time, so scholars who work with material semiotics are inspired by semiotic studies, which is to simplify the study of science, okay? And so we extend the study of science, we extend semiotics to things, non-humans and objects. And so if we think of words, words do not directly refer to an already existing object, but they acquire their meaning relationally. And with this, having this in mind, we extend this to our understanding of reality. So things acquire their meaning relationally. So what is this table? How does it become a table? Is there anything essential about this table being a table, or does it acquire its meaning in relation to other entities, in relation to other objects, in relation to me using it as a table? So the wound itself becomes a wound, and it becomes various things as well in relation to people, to stitches, to medication, to the state, to the various institutions, to medical practices. And so now, wound is also enacted in relation to, like I said, to various entities and various practices. So sensing the wound, touching it, smelling it even, and then other practices such as walking, exercising, eating, and living with it all enact the wound. They affect how the wound showcases itself, and the wound itself affects people that surround it and various entities that surround it. It is handled differently at the hands of a physician, handled differently at the hands of a photographer, an artist, in reconstructive surgery rooms, in private settings, in public settings. So this is my conceptual framework. And these two theorists on top of this really do inspire me. Now, Omar Dawashi is a medical anthropologist and physician. He's conducted fieldwork in Iraq and in Lebanon, and he suggests to study the wound as a method, to follow the wound as a method. And so what does this mean? So he suggests to build an analysis of vulnerability in the trajectories and experiences of the wound, the various ways that a wound travels and embarks on trajectories of care, and to follow the wound as a method through very different geographies of wounding, precarity, and survival, and to unravel the social and ecological relations of the stress and care through the wound, as wounds are exposed to various institutions, medical, political, social, economic institutions, and risks. At the same time, he has an interesting way of defining the condition of being wounded, woundedness, and he says, majruh in Arabic not only means being wounded, but it also means to carry memories of pain and histories of wounding processes. At the same time, I'm inspired also by Just concept and theory, the right to maim. And so here she looks into intentional maiming and debilitation. And she asks what kind of sovereignty is being articulated when the right to kill is enacted as the right to maim. So when a foreign entity exercises not a right to kill, but a right to maim, intentionally maiming rather than killing as a tactic to target both bodies and infrastructure for debilitation. And I'll get to bodies and infrastructure later. And so this element of biopolitics entails targeting for death, but not killing. So let's start with my first analytical point. Now, first of all, I'm interested in seeing, in looking at the life worlds of wounds. Where can we locate these wounds? Who enters the world of wounds? Perhaps me, myself, as an anthropologist, I'm also a part of the life worlds of wounds, as an additional thought. So Diwashi argues that the wounds are deeply embedded in social relations, and to repair a wound, we must attend to a broad network of care and social relations. So in everyday caring practices, in private settings, let's start with first private settings, we have kin, family members, friends, lovers, comrades, acquaintances, and co-workers who all venture into the life worlds of wounds. They apply creams, clean, disinfect, and medicate the wounds. They bring care, comfort, attention, and solidarity to the wounded body. And so here we're interested in these caring practices because they foreground interpersonal relations and mutual dependence, quote unquote, Mullen Harden. And so here in these everyday caring practices, while various individuals are involved in giving attention and various forms of care to the wounds, they're in return affected by the wounds. The wounds have this power to affect people. They become affective entities. And so they carry this affective resonance that allows them to transcend bodies and break down bodily boundaries. And so Hagop is wounded and injured. And Hagop's sister, who doesn't carry physical wounds, but she also feels a form of woundedness. In another case, while I was interviewing a Syrian family that lives in Beirut's Karantina neighborhood, which is, which was at the center, at the epicenter of the port explosion. The father of the family, I was, conversing with the father of the family. I asked him, "What is your relationship with your wound?" And he told me, "Well, perhaps you should ask my wife about that." And then he told me, "Let me tell you something about my wife. She's suffering with the thing on her head and on her face," and he meant to say the wound on her face. She said about that, the look, but she is also very sad with her son's scars. You saw it. It's a lot. She's a mother. She's feeling it with her son. So here again, the wound breaks down the body boundaries between the mother and the son. Though she herself is also injured, she's carrying her son's suffering on top of her own individual pain. So here, again, wounds become affective entities. They have the capacity to affect and pull people toward them and mediate various relations. In this case, an already affective relation between a mother and a son. Now, moving on to my second analytical point, which looks into now the wounds perhaps in the public sphere now, in communal spheres. And so here I argue that in the public sphere, the way we care for wounds, we might encounter certain frictions. And so while wounds are these relational entities in everyday care practices within private settings, they also become collective and communal entities when they enter the world of reconstructive surgeons, dermatologists, and ophthalmologists, who also enter the network of wounds, attend, or give care to the wounds. Now here, multiple forms of care for different approaches, they intersect, they overlap, and they might create forms of friction, or they might appear in ways that makes us question about what is good care, what kind of care should we give to wounds. And so here, I was interested in seeing how wounds become public entities and objects of gaze. So now we, beyond the private setting, in the public sphere, we have many people who are gazing at the wound. They can see it. And once wounds become objects of gaze, they appear, various people enter the debate of the appearance and the disappearance of wounds, whether these entities should be displayed, they should be concealed, removed, celebrated even, or hidden. So my interest was in, and I came across various advertisements that were put out by private clinics who were engaged in these laser scar revision treatment therapy. And so we read here, and so they launched these community initiatives at the time in the aftermath of the port explosion to offer either free or partially discounted medical advice or scar removal or even consultation and therapy. So on the left, we read, do you know someone whose face scars need treatment? Share this post and tag them. With our laser scar revision treatment, we leave those scars and bad memories behind, hashtag face of Beirut. On the right, some scars won't heal with time, but they will heal with our laser scar revision treatment. Now, of course, there's an obvious marketing language here and a kind of a neoliberal logic of care, you know, kind of this push towards you have a choice, you can remove the scars. And then we can also question, I mean, especially in the first picture on the left, the face of this woman. So who gets to be the face of Beirut? Whose face is at the forefront? And if we treat the face of Beirut, if we just treat the face, will it take away the deeply ingrained generational woundedness? But beyond these questions, something else is happening here. There's a collective we, consumers, the gazers, those of us who are gazing at the wound, we're entering the conversation as if we're also responsible for making decisions. So if you know someone who has scars on their face, tag them, let us know. Perhaps they should, you know, think about the treatment, whether it brings comfort or discomfort or whatever. That's not the point here. But the point is that we as well, the public, the community, enter into the decision in the decision-making processes to think about what should happen to wounds. And so, interestingly, by becoming public entities, these wounds might eventually get public might decide to remove the scars. And I get to my third analytical point. And here we get to a different level by thinking about how wounds become political entities, and they carry this force to affirm life in the face of debility. Now, in both cases, let me start with the first case, Beirut port explosion. In the aftermath of the explosion, many photographers publicized photos of wounds and wounded bodies. That was also how I was very much interested, and I was engaged in seeing these photos and gazing at the wounds myself. And about a year later, on the 1 year anniversary in August 4, 2021, there was this one photographer who published a series of the scarred bodies, and he claimed the following. He said, the physical scars of the August 4th explosion tell the stories of how our city got destroyed by our own government, our houses stolen from us, our bodies disfigured and killed. So here, ones are doing something else as well, interestingly, not just mediating relations, but they're becoming translators of ongoing crises and the collapse in the country, and as if they've now become an evidence of a crime. And so, because they're not the result of an accident, but they're the consequence of a chain of political decisions. So they become a proof of a political disaster. Now, in the second case, in the case of the Israeli pager attacks, beyond the debilitation of the bodies, there's also intentional decision to debilitate the infrastructure. And here I quote Poir, and she says the following. She argues the following. Maiming functions not as an incomplete death or an accidental assault on life. It's not accidental, it's very much intentional, but as the end goal in the dual production of permanent disability via the infliction of harm and the attrition of the life support systems that might allow populations to heal from this harm. I was watching this interview a month ago. This woman who had lost her eyesight in one of her eyes, and her face was scarred, and and her hands were maimed and debilitated. And she gave this interview to independent media outlet Breakthrough News, and she explained how she had to go to Iran to receive a medical care to receive corneal transplant. At the same time, ophthalmologist Ilyas Jarade, who was very much involved in treating victims of the Israeli pager attacks, those who had lacerated eyeballs. He claimed that there was at the time a blockade, a siege on cornea imports in Lebanon. So at the same time, not only do we have an entity that is debilitating, intentionally maiming bodies, but it's also intentionally debilitating an infrastructure, the healthcare infrastructure, and keeping these bodies perpetually wounded. So I maim you, but I also maim the infrastructure that will give you care eventually. And so in this context, what happens to the wound? Not only does it become a political entity, but it becomes the indicator of something larger here, something political. It becomes the evidence of a crime, of violence, of terrorism. But at the same time, interestingly, wounds have the ability to showcase a firm life in the face of these intentional debilitation. And so how do they do that? Where do they do that? And here, there's in September 2024, as well as later on in, I think, February 2025, photographer Fatima Al-Jum'a, she published a very series of photographs that depicted individuals with wounds and scars affected by the pager attacks. And on the left, we have a couple who found hope. But this is how she captioned the photo. She says, a couple found hope amidst the chaos, and despite the groom's injuries, we can see the hand. They exchanged vows in a simple katib ktib ceremony inside a hospital in Beirut's southern suburbs, in Dahieh, surrounded by medical staff and family. They celebrated their love, turning a moment of pain into one of hope and resilience. Another on the right now, in another public communal gathering, mourning the month Muharram, the first month of the Islamic calendar, in Dahiye, she also portrays now wounded bodies. And in the series, we can see many who are wearing sunglasses. Some of the men have their eyes covered, their heads covered. But we can also see this interesting image of a hand wrapping something as mundane as simple as wrapping a manouche, and then we can see the amputated fingers. And so here, not only are wounds communal, not only are they political, but they also have agency. And so they have agency. They're affirming this agency in the face of, in this case, a foreign violent intervention. They're affirming not only resilience, which, well, many of us do kind of perhaps are tired of this term in many contexts, but they affirm here resistance, and they affirm these resistance in seemingly mundane activities by showcasing that we are here and we're living. I mean, maybe getting married is not that mundane, but they affirm life in the face of debility, contesting erasure. And here I'm also inspired by Munira Khayyat's her particular approach to a concept called resistant ecologies. And she says the following, she argues the following: over time, people have devised ways of making do, and some of these makeshift practices became ingrained as resistant ways of life, cultivating sustainable networks of protection and care and subsistence if possible, expecting the worst, hoping for the best, living the moment, and always being prepared. I call these life-making practices and relationships in deadly times and places resistant ecologies. And so here, Munira Khayyat's concept of resistant ecology is very much is inspiring, because in seemingly mundane everyday activities, in a particular ecology that is itself resistive and resistant, people affirm life, and wounds themselves carry the agency to affirm life in the face of debility. So how to conclude? Wounds carry a multiplicity. There are multiple entities. In one, if you just pick one wound, we can study it and we can understand it from various levels. First, through everyday care practices and communal care and public care, we can think of, and we can definitely see how wounds are at the same time relational, affective, social, communal, and then political entities. And in a state of chronic collapse, such as in Lebanon, wounds challenge the debilitated environment, and they contest political forgetting and assert life and visibility in the face of debility and abandonment. And here I'm quoting one of my informants from 4 years ago, who was speaking about his wounds and some of his scars following the Beirut port explosion. He was injured in the Beirut port explosion, and he told me, even when we are wounded, we invest in our pain until it leads us to justice. So relevance, since I come from a different background, I come from anthropology, medical anthropology. So what would be the relevance, perhaps? I try to reflect myself how this would be relevant to physicians, practitioners, to scholars in the health sciences, in public health, communal health. And well, for the past 2 years, we all have been consuming images and photographs of wounds and injuries, not only in Lebanon, but then we have been witnessing the maiming and the injuring, the intentional maiming of Palestinians in Gaza at the hands of the Israeli state. And I find it necessary here now more than ever to turn to wounds and to adopt Dewachi's approach to approach the wound as a method. And here, the relevance, it's very much relevant for us to attend to the social and the political aspect of wounds, to expand our understanding of the human costs of political disasters, war, foreign interventions, and to locate the fleshy wound as an entry point to larger contexts and histories of violence, suffering, and debility. So these are my references. And thank you for your attention, and I'm ready for your question.
Thank you so much. I think that was extremely inspiring, and it invited us to look at wounds and injury from a different perspective. I think for a public health audience, it's really, it opens our minds. So thank you so much. I found it inspiring. We're going to open the floor for questions, and I'm going to also monitor the chat for our online audience. Okay, but you have to use the mic so that the online won't hear you.
Okay, so if we want to refer back to the slide where they talked about the laser treatment to hide the wounds, a lot of people don't want to do this treatment just because sometimes if you have a visible wound, maybe it would really show you that the wound exists, because the internal forces or the internal scars that exist inside may be reflected by the external wound that you see. So if you hide the scar from the outside, doesn't mean that the wounds have been hidden from the inside. So maybe this ad would be sort of like seen negatively by people who would have this perspective. Who would prefer to maybe keep the external wound because it would be an evidence that my wounds are valid, versus if I hide it, then maybe the internal wounds will be there and not seen by anyone else, so no one would really see their suffering.
Yes, thank you for your comment. Yeah, thank you for your comment. Definitely. Now, one of my informants, I mean, I actually found out from her that there were these free treatments. She was following these treatments, and she told me, I thought about it. I mean, these scars kind of tell the story of how brave I was, but I might regret if I don't do this now. I might regret it maybe later on. At the same time, I had another informant who told me that she rejected even using scar removal creams like Mebo Scar, and she gave this interesting analogy saying that her scars are like a tattoo, and they tell the story of her pain, so she doesn't want to remove. So yeah, we do have this definitely individuals who might be affected negatively by these ads, at the same time positively. But the interesting part is that we're all entering this conversation. We're trying to think about what should happen to wounds and what should they become. So thank you.
Yes.
I need a microphone. Thank you so much for this very interesting talk. I wanted to ask you about how you see the connection between wounds and debility, because Jaspir Par's book is about debility. And you mentioned Gaza. And, if you think that wounds are transient, but it's the debility that will remain. And that's the intention at the end.
Yes. Thank you for your question. So interestingly, Puar looks into kind of challenges this idea that if all of us, if we live long enough, we will at one point we might face disability in one way or another. And if that might be true in certain cases, but she challenges this idea because she says it really is dependent on where we live, what our access to particular infrastructures, what would happen to us in specific contexts that are already that are already face chronic collapse. Now, the ability is interesting, particularly in the context of the pager attacks, particularly in the intentional maiming and the intentional debilitation of bodies, and at the same time, the wounds are the very visible result of that intentional debilitation. But then there are also the reminders that if they remain, they also connote that there's a system, there's an infrastructure that has been debilitated because they have remained. If a body remains wounded, it might mean that there was a system that could have perhaps treated this wound, but this wound remained, showcasing that the system itself is debilitated. So my interest here is not only is kind of twofold. So at the same time, I'm looking at the wound itself as being the result of it being the debility and the result of debilitation, and then the marker of the debilitated infrastructure and environment. So I hope I answered your question.
Thank you. We'll take Dr. Nwayhid, and then we have a question online.
Again, thank you. This is very interesting and capturing and painful. So I don't know whether these are questions or comments, but I've heard Ghassan Abu Sitta talking a lot about the change in the meaning of wounds. So how these actually in the present and with time. So those wounds, especially talking about the pager victims, they're seen differently, even in Lebanon, depending on the political divides and all of that. So some see them as a proof of resistance and steadfastness and all of this, but the others see them totally differently. And so it's on one hand an agency, but it's also this agency. So if somebody comes to your neighborhood, to your building, you ask the question, is he going to actually be my neighbor? Is he going to rent here? And is he exposing me to certain dangers? So again, to reflect on that and how the meaning of the same wound would change with time. So and so the gazing will take a different thing. I'm not fully capturing the concept of the debility. So we're still talking about it as an individual, or because again in Gaza the Israeli soldiers were shooting, especially during the protests, the march protests. They were intentionally hitting them at the knees, which is one of the most debilitating wounds. And so the intention is not only to debilitate the family and the person, but also to undermine and the whole health system, because it's very difficult to treat, and then you have rehabilitation for years and others. So the intention is beyond the individual. And if I may, so the again, a side thing, as I was listening to you, and excuse my ignorance here, but in the medieval times, at least from books and movies and others, a protester, they used to cut the tongue of a protester or take the eyes out, so that this person is punished and represents actually an example for the others, not to resist and not to object. But this, what the Israelis are doing, and the whole issue of this, the right to maim, how recent it is in the modern wars. Because usually, whoever is inflicting violence, they torture and then kill. They torture towards killing. And in this case, one was this, so it's 2017, 2000, these books. Is it recent that this is actually coming up as one of the tools of war? And again, the last, sorry, this is a side thing. I don't know whether you've read the book, a novel, Frankenstein in Baghdad. Yeah, so that's the story of a person who collects the body parts of people who are killed in different explosions around Baghdad. He collects them and actually stitches them up to form a new person who actually comes to life and roams the streets of Baghdad. It's a scary story. Ahmad Saadawi, I just checked it. Frankenstein in Baghdad. So I think it's very relevant to what I think it was Omar Dawashi who at one point recommended that book to me to read as a novel. So sorry for the multiple.
Thank you.
Thank you, truly, for your questions and comments. So I will try to answer first about the meanings, the change, and I will go back to my conceptual framework, so if we study the wound and the being of the wound as part of a relation, as it enters the relation, and we can see various entities that enter these relations, various individuals, ideas even. So entities that come from different forms, human, non-human, maybe concepts, ideas, the state. And so if we study from this framework, yes, the being of the wound and the meaning of it will change if it enters a different relation. If someone leaves that relation, something else comes in. And so this is why actually that framework was very interesting for me, because the wound was given various meanings, and embodied various meanings, and it actually became various things for various people. So yeah, in the context of the pager attacks, and my observations are recent. I hope to expand it, but then you also very interestingly touched on the ethical side of it, and actually the methodological side of if whether it is even possible to interview ethically individuals who are injured. Perhaps we might endanger them, or it really depends on the context, depends on the political context as well. So yeah, at the same time, protesting, there's a scholar, Deepti Misri. She's a scholar in critical Kashmir studies, and she has this article, I think it's called Showing Humanity. And so she looks into how protesters in Kashmir were intentionally shot by the Indian police with it's called non-lethal bullets, and yeah, and she even looks into the term non-lethal and the whole idea behind it, how that itself is this dehumanizing, but in the context of Palestine, Puar goes back to second Intifada. She talks about how over time this intentional this right to kill was replaced by a right to maim. So in a way, this is a tactic to say, okay, we're not killing. We're just trying to cut down the protests. We are undermining resistance. We are trying to destroy resistance, trying to destroy life, but we're not killing. We're letting people live, and that in itself is quite violent, because how you have the right to choose how people will live if they live. So it is not very recent, but I think, of course, depending on how we see history, but yeah, in the context of Palestine, it is not very recent, no. But here now, I think today we can go back and think about this further. So yeah, thank you for your comments.
Thank you. So maybe we'll answer our last question from the online audience. So this is our student Zuhair, who is asking, how does this differ for multiple repeated wounds from serial or systemic violence versus more acute situations?
Thank you for the question. Do you mean to say that so the same perhaps person gets injured multiple times? Is that the question, or is it about particularly serial systemic violence? Okay, or is it about the environment itself of locations that are face injury multiple times.
Hi.
Zuhair, would you like
Can
to
you hear me?
clarify or he unmuted himself? Yes, Zuhair.
Yes, we can hear me. Okay. Hi, first of all, thank you so much for the
We cannot
presentation.
hear you.
Oh, can you hear me now?
Would you like to type?
Yeah.
I think
Maybe it's the latter.
Yes.
So we have another.
Oh no,
No problem. Okay.
So actually, it is interesting for me as well to when I first started studying wounds in the context of the port explosion, my interest was to actually look at the port explosion not just as an isolated situation event on its own, but to put it as as a part of a chain of crises and collapse. But yeah, repeated injuries to the same individual. Now, this is an interesting question. I haven't focused on I haven't interviewed people who have been who have been injured in multiple times or in various because of various situations, but this would be a very interesting thing to look into, particularly in the context of Lebanon. So thank you for the question. But yeah.
Thank you.
Yeah, would be a new thing to look into.
But Dr. Malki has
Thank you for your presentation. Obviously, there are two groups of wounded patients here. Some of them from the port and others from the war. So there are common physical injury. What about the psychological effect? Are they common? And there is a follow-up on these patients.
Yes, thank you for the question. I mean, definitely. In many of the interviews, I mean, I myself didn't focus on the psychological aspect, even though that was very important. But I am not trained. I don't have that background myself. But many of my informants address this idea that, I mean, okay, these things ماشي الحال, but what will, you know, I don't even want to talk about the nightmares I'm having, or some had even consulted the therapists, and one told me that it turned out that I don't have PTSD, interestingly. But so in both cases, I myself haven't focused on the psychological effect because it is outside of my training as well. But it is very much necessary to look into that, definitely. But perhaps I would say, and I don't know if I can make this comment, perhaps not in connection. It would be perhaps if we should take these two cases now separately.
Really, I think it's obvious from the engagement of the audience how much they enjoyed the and were inspired by the presentation. I'm sorry we cannot take longer. There's a class at 1, but if anyone, I know someone has raised their hand, may I suggest that you can communicate, email
Yes,
perhaps Narod your question, and I'm sure that you will be very happy to engage with you offline. Thank you
so much.